As we know, San Diego has a booming medical tech industry, but with that comes the growing threat of healthcare hacking. Local medical security experts are starting to raise their voices about a new target, medical devices like pacemakers. This comes as the FBI has a new warning.
And Team 10 investigator Jennifer Kastner has spent the last few weeks interviewing local healthcare professionals and reading through the cybersecurity reports.
Well, Kimberly, hospital hacking is becoming far more common, often for ransom. In fact, a San Diego hospital was the target of a malicious software incident last year. Cybersecurity experts are quick to try to protect patient records, but protecting patient health is a new problem. We watched as medical devices were hacked in front of us.
We're going to attach a patient now.
And I'm the patient, a patient they're going to let die.
Say when?
At least in simulation. San Diego cybersecurity expert Ted Harrington and his colleague hack what's supposed to be a nurse's computer to make it look like I'm healthy.
Good O2 levels.
But I've already removed my finger from the sensor and flatlined.
But what does the nurse see? The nurse sees a perfectly healthy heartbeat.
These monitors and other medical devices like pacemakers are some of the newest vulnerabilities to cyber attack in the healthcare industry. The threat hits home. The state has more medical device jobs than anywhere in the nation, with 74,000 employees. 7,700 of them are here in San Diego.
We're in a city that is no stranger to malicious software or malware assaults on the med sector. Just last year, the 306-bed Alvarado Medical Center had its computer system affected by what it called a malware disruption.
They considered our request for an on-camera interview, then backed out, citing in part, a careless slip during an interview can reveal possible chinks in our armor that a hacker can take advantage of.
Also a developing story now. The FBI looking for whoever hacked an LA hospital's computers.
And the nearby Hollywood Presbyterian Medical Center made headlines last year when it paid a $17,000 ransom to a hacker who froze its record system. Healthcare is attacked more than any other industry because that's where the money is, writes one cybersecurity leader. A records check shows 13 California healthcare groups currently being investigated for reported hacks. Now the threat to patient privacy could be challenged by a threat to patient safety. Look how fast Harrington's colleague can hack and change a reported blood type.
If the physician thinks a patient is of a certain blood type and orders a transfusion of a different blood type, that directly hurts the patient, actually would most likely result in fatality.
Last month, the FBI put out a warning about growing concern over hacking medical devices. You may remember former Vice President Dick Cheney had his pacemaker altered to prevent an assassination attempt.
We can't bury our heads in the sand anymore. These types of medical cybersecurity vulnerabilities are going to become commonplace.
Dr. Christian Demeth at UC San Diego is also a self-described hacker. Despite the FDA's claim there's no cases of patients' devices getting hacked, Demeth believes attacks have happened, even if they were unintentional.
These devices and our systems are not well equipped to even discover these types of attacks. It's essentially like asking a toaster to figure out if your house has been hacked. They're just not designed to find out.
So something important to address here is probability. Experts say the threat is real, but the probability of an attack, intentional or accidental, is very low. They don't want to scare people out of getting devices like pacemakers. Just be mindful of the risk and talk to your healthcare provider about ways to safeguard. Kimberly and Steve.
Jennifer, thank you. A new